Thank you for joining us here on Stress Free Aging. I'm your host, Amanda Allen, and we are here discussing today all about placement for seniors. So I'm very excited to have our special guest here. She is the owner of Senior Care Authority. I also work with Tammy Gripton. Thank you for coming and being a part of our show today. So can you tell me a little bit about Senior Care Authority and what you do as a placement specialist?
Okay, well, I have people call me from all over, and I can help them with anything they would need for senior services. But what I specialize in is placement, and so I help seniors find a place to live in independent living, assisted living, memory care, or residential care communities, or also known as group homes. I help them find their way into the correct place for them.
Okay. And is there a fee to the clients and the families that you're servicing?
My service is free to seniors and their families. I never charge a senior money for any services they would do. How I get paid is a percentage of the first month's rent after placement from the community.
From the community. Okay. Mm-hmm. And how exactly, if someone comes to you, how exactly do you assess a client for placement to make sure that you find the perfect place for them?
Well, I have a very comprehensive assessment where we sit down. It takes maybe about a half hour, 45 minutes, and I ask questions regarding care. Exactly how much care do you need or your family member need? So there are three main things. Care, how much care do they need? What area do you want to live in? And how much money do you want to spend for the placement?
Okay. Mm-hmm. Okay, that's good. And what? So how would a client pay for an assisted living cost? Like, let's say, and what's the difference between? First, let's start with that. What's the difference between an independent living versus an assisted living?
Okay. Well, independent living is where people. Sometimes they can have a little bit more care, but it depends on the community. Some communities have a care company that's attached to the community, and so they move in, they have their own apartment. Usually it comes with some sort of meals and housekeeping, and then if they need any care, they would contact the third-party provider that's also in the same community, and they would work together with the assisted living to develop a plan to make sure that all of their needs are covered. So maybe they're super independent and they're just looking for meals and maybe having their medication managed. That probably independent living is going to be the right choice.
Okay. Okay. And then, so they can be independent and have just med management.
Mm-hmm.
So,
and some places you could be considered independent, and as long as you're not trying to escape the community, because usually independent living doesn't have a locked door, so you could stay there and even age in place using their care team that is in the community.
Okay. And we've discussed this before on a previous show. I've placed in one of those communities, and we've had additional services that were brought in through hospice where they can go on hospice services, things like that. So that's an option for families that maybe don't want to have their loved one at home with them themselves, mm-hmm. and they want to go ahead and place them, and it might be a period of 6 months or less, mm-hmm. and mm-hmm. therefore being able to have the care. And I've seen that happen, and it's worked out very well.
Yeah.
For that situation. So how would, after you do the financial assessment, what are some of the ways that a client is able to pay for the services to go into a community like this?
Well, most of the communities, I work with Medicaid communities as well, and I help people find their way if that's what they're looking for. But if they're looking for just regular independent living, assisted living, or memory care, it's usually private pay, but there are resources to help with it. So usually people choose to stay in their budget. Like, number one, they would maybe try and use the money from their pension and their Social Security. Possibly they've sold a house So then those resources could also be used towards paying the fees. Also, there's veterans aid and attendance. So if you're a veteran or you're a surviving spouse of a veteran, and you fill out the correct information, you could be entitled to some money to help pay for assisted living and memory care, and even some parts of independent living. There's also the Medicaid waiver.
Medicaid waiver. And then there's also the long-term care benefit that some people purchase in their 20s or 30s.
Yeah.
They get that as to take care of themselves when they're aging, and they're able to use that money to find a nice place.
I think in some some employments also it was a part of the benefits package at one time.
Really?
So yeah, I had clients tell me that before.
Really? I had no idea. So walk us through what happens when we have a client that contacts you. So what does that look like? I know what I do, but I want you to
so it's
explain,
good to explain it, because we do the same. Well, like I said, it would take maybe a half hour, 45 minutes to get all the information. I ask a lot of questions about the care that someone might need, get to know the family, try and get to know a little bit of their past history, things they enjoyed when they were younger, different employment history they had when they were younger, things like that. And then we develop a plan. We usually try and come up with like three communities that fit the client's care level and price and area.
Okay.
And so after we've done that and we found 3 places, then I would contact them again and explain to them exactly what the care is, that what places sound good, take their information about it, see if they like those places, and if so, I would schedule a tour and we would go tour them.
And that's what I like about that. I know there's several different ways that people can find someone to place someone, but that's the benefit of having Senior Care Authority, having you, myself, that can walk someone through this process, because there's also so much anxiety, and to have someone just there by your side and walking you through that, it can be so it just helps so much when it comes to that.
Well, and sometimes people will decide to call and say, well, I liked this afterwards, right? Well, I liked this, I didn't like that. And then maybe we even change the plan.
Right.
But every tour, we're there with them. One of us is with them and there to ask the right questions if no one's asking any questions, and to be a support person.
And I think that one of the key things to say that what I have found is that there are all different price points for someone to use these services. There's, it can be a very high-end place, it can be a median, or it can be a lower income based place. But I know that one of the things that I found is that walking into some of these communities, they have the activities director, they're keeping them busy. In some cases, they probably are becoming much more social and being able to have meals with friends. And you and I have both done events at senior living communities, and we know how it is, and it's fun to kind of hang out with seniors there. So,
well, and what I always am struck with is it's not like an old-fashioned what you think, like what people used to call a nursing home is.
Exactly.
This isn't a place where you go to die. This is a place where you go to live and experience and have social interactions and have lots of fun with friends.
Exactly. I know that a particular community that we work with and we use quite a bit, they have a woodworking program for the guys that are there. They're able to tinker with cars and car parts and things like that, which I think are great for someone that's aging that still has some ability to be able to do that. I've seen communities that have happy hour, and yes, it's with alcoholics now. It's kind of a fun place for someone, instead of saying, hey, let's let's go in a nursing home and hang out there. I mean,
It's in some
it's
places
just really,
it's like a high-end hotel.
it is. It is. You have your laundry done. You have your laundry, your cleaning services, your bed is made, all those kind of things. So it's a really good. I want to discuss something new that you have that it's a new service that you're offering now. Can you tell us about that? Because I'm very interested in it.
Well, so Senior Care Authority is a franchise. I'm a local franchisee, and our franchise, we've just started with the training for Beyond Driving with Dignity, and it's a program where sometimes families know that it's time to possibly have the senior stop driving. Now, I'm not someone that would have the authority, nor would I want to take the keys away from anybody. But it's a sit down at the table conversation regarding when is the right time to look at. There are some seniors that have gone to jail because they should have stopped driving and they didn't, and then they got in an accident and someone died. And it's about making the responsible choice as an adult, and it wouldn't be me making that decision, nor their children. It would be them, but helping them see it clearly, exactly what kind of choice they're making by continuing to drive. And I do charge for that. That's an additional price. So no, it's not like paid for by the community. That's something that that families would pay for. But it's like a 3-hour sit-down conversation.
Okay. So it's like a 3-hour. And can you tell us a little bit about like what happens in that conversation? Is it the cause and effect? Things like that, having those kind of
Well, there's questions that the senior has to answer that they need to be honest with themselves, because it's not really about me, not really about their kids.
Right.
It's about the safety on the road. It's about safety for others and themselves.
Okay.
And making the responsible choice. And at the end of it, I don't make the decision for them. They make the decision for themselves.
When they go through that process of, you said it's called Driving with Dignity.
Beyond Driving with
Beyond Driving with Dignity. Okay, so when they go through this process, they give the senior choices of other modes of transportation, letting them know what they can do to get around and still feel independent?
Well, I mean, there
Is
are
that
lots
part
of
of the
options.
process?
It's not part of that. It's
It's
not part of the
it?
sit down,
Okay.
but it's easy to have that conversation.
Right. So then give them choices afterwards, saying this is what you can do and instead type of a thing.
Nobody's trying to take away anybody's freedom. It's more about what's the safe choice for seniors and everybody on the road as well.
Okay. I want to go back. To the senior placement for just a second. Many times these senior placement takes. It's a very sudden thing that it happens. There's, someone breaks a hip, someone falls down some stairs, they've been in the hospital, they're being discharged. Maybe they're home with their children for a small amount of time, and then that's when the family says, wait a minute, mom or dad is not safe going back home. That's kind of when the process of someone like you is be able to be contacted.
And I can help them move someplace quickly as well. So
That's
if
good.
it's an emergency and you need to move quickly, I know the places that'll work with you to help make that happen. Most places will.
Right.
But I can help you. And the best part about my service is I ask how much money you're looking to spend, and I keep all your information private. I'm not mass emailing all the communities, and that's really appealing to a lot of people I work with.
Right.
Because there are other companies that also do placement, but they share the information, they mass email it out, and then you could be getting
Phone calls.
a ton of phone calls. And if you're in an emergency situation, that's the last thing you need. You need someone to be there and to guide you through it step by step, every step of the way.
So can you tell us like how you would get a referral? Can just someone sees something on Facebook, can they contact you?
Yeah, well, I have a website.
So if they see this show,
Yeah. Well, and I have a website. It's seniorcare-macombcounty.com, or you can Google Senior Care Authority Macomb County. And they contact me, and then we just start with the process. Or I get referrals from other people in the senior community. They'll send me information with someone's permission, and either I'll call them or they'll call me.
we've also gone into long-term care facilities, rehab centers, where a patient is done with their rehab and then they need to be placed somewhere. We've done that as well.
Yeah.
Sometimes it comes straight from the hospital. There's a whole bunch of different ways that we could get our referrals, but I just wanted to talk about that. Is there anything you want to tell us about how we can assist the seniors out there? Anything else you want to add?
Well, I also do something called, we also do elder care consulting. So if someone calls and they need help finding a Medicaid bed, well, we can help connect them to the resources for that. Or if someone wants in-home care, we can connect them to those resources. Maybe they need an elder law attorney because they want to try and get their power of attorney
This
set
is
up.
a great time for us to talk about it. We can help with VA benefits. We can get them in touch with someone like that. If they need to do a will, if they need to have some type of asset money management things, we can
Financial.
We have private duty companies we work with for nursing. We have home health, hospice, transportation, medical equipment. Even we even work with like the financial planners. I'm trying to think of everyone that we work with. There's so many, and we have such great connections, so we're able to really bring those connections together as an elder care consultant. I think that's a great thing. I want to thank everyone for joining us today. If you want to find out more information about our videos, we have you can find these videos on Stress Free Aging on YouTube. Again, that's Stress Free Aging on YouTube. They can find that. Now, how can listeners get in touch with you?
Well, so you can go to my website, seniorcare-macombcounty.com, or you can give me a call, 586-917-9170, or you can email me, Tammy, Tammi, at seniorcareauthority.com.
Can you give the number just one more time?
586-917-9170.
Thank you.
Thank you.
Great job.
It's really fun.